Now I welcome respected chairpersons for the reverse panel, Dr. Veera Lohia ma'am, Dr. Kusum Singhal ma'am, and Dr. Sadhana Kumar ma'am, to introduce our next chairperson, speaker, Binaifa Agarwal ma'am.
Thank you, Kirti, and Dr. Shashi Srivastava for inviting us and giving us this opportunity. And we have today Dr. Benifer Agarwal. She is practicing at Agarwal Dental Clinic, Bhopal, and member of Indian Dental Association and Indian Prosthodontic Society. She has attended over 50 national and state conferences, been a guest speaker at national and international forums, and coordinated multiple conferences, hands-on courses in prosthodontics and implantology. She
actively participates in community dental awareness programs and professional development initiatives, contributing significantly to academic excellence and clinical advancement in prosthodontics. I invite Dr. Benifer Agarwal to take the session.
She actively participates in community dental awareness program and professional development initiatives, contributing significantly to academic excellence and clinical advancement in prosthodontics.
Introduce our chairpersons also for the session.
I welcome Dr. Sadhana Kumar, Madam MBBS PG Diploma in Maternity and Child Health. Dr. Sadhana ma'am is completed her MBBS from Gandhi Medical College and PG Diploma from Indira Gandhi National Open University. She retired as AGM Medicine from Bharat Heavy Electrical Limited, and she has served as Indian Institute of Science, Education and Research Center and WHO Associated Presenter with 2-time SS Trophy Awards. Thank you, Dr. Sadhana. Dr. Veera Lohia ma'am, she is MS FICOG, Senior Consultant Gynecologist and Director of the Janak Hospital. She has served as President of IMA Women's Wing at Gwalior and Secretary of MPOX, a Master Trainer and Assistant Director at IMA College of General Practitioner. She is also co-founder of Health Plus Club, former Corporator of Gwalior, and an awardee for her services. Okay, so you have a lot of this feather in your cap, especially the corporator. Dr. Kusum Lata Singhal ma'am, MS FCMCH, FICOG, and Senior Consultant Obs Gynae. Dr. Kusum Lata ma'am is a Senior Consultant and Director of Koteshwar Hospital. She is former President of Gwalior Obs Gynae Society and Chairperson of IMA AMS Gwalior. An awardee of Foxy and Nari Shakti Honor, she is an author, national faculty, speaker, and active member of Rotary International. Welcome, ma'am. Okay. And I will welcome Dr. Rashmi Agarwal, madam, and Dr. Veena Pradhan, madam. Little introduction of yours. Yeah, please.
Very good afternoon or evening to all of you. It's my pleasure to be here. I'm thankful to the persons who are on my team, especially the Shashi ma'am who has given me the opportunity. And another thing is that I'm a retired medical.
I think it's my privilege, or I have been given a task to give my own introduction. Okay, I have served the society for 40 years and I'm doing social awareness and services without any help of any NGO since last 40 years. I have been awarded so many things where the most important is that is the Malti Joshi Award, then the Kaistaratna Award, then in 24 I was the only one lady who was awarded for the social awareness and the women empowerment by the National President IMA, R.V. Raman. Then another signature award, that is international award, it was given in last year in the December. working in the GOX. I was vice president for 3 years, then working as the executive. Now I am working with the GOX as an advisor. I am chairperson of Mission Pink Health. Another, I have been selected for the zonal chairperson of the IMA. Thanks for all that.
Thank you very much, ma'am. This is what the self-love is.
No,
and
no.
self-respect. No, ma'am. What I mean to say, we're so confident if you say about yourself, that means it's wonderful.
Then listen one thing more. I have been awarded for making short video from the National Foxy President in 1923 for the breast carcinoma awareness self-examination of breast and for the slogan of carcinoma cervix. This year I have been awarded for the carcinoma on the 4th February.
Congratulations,
For the
ma'am. And it's really inspiring. Really inspiring.
And for the poem for the breastfeeding.
Wow, wonderful. Really wonderful.
You people are wonderful that you have given me the chance to say something about me,
Ma'am,
which was not required here.
I know it's our fault that we couldn't say about you much because there was some missing link. But that the missing link, like the gynecs and the dentistry.
Okay. But seeing these videos, I have planned. There is my YouTube channel of my own,
Yes,
Healthy
ma'am.
Tales and Tips by Dr. Veena Pradhan. There's so many videos are there, but without any medicine, how can you change your lifestyle and be aware of that? There is 2 or 3 videos for the oral hygiene also.
That is very
After
important.
seeing these things,
Yeah.
I'll make another video for you people.
True, ma'am.
And by taking help of you people. Thank you very much.
Hello, thank you. First of all, I thank the organizing committee for calling me here. I am really grateful to them. I have a very short introduction. I have been practicing for the last 30 years. I run a full-fledged pediatric and mother care hospital. We have been running it for the past 30 years. Thank you once again. And I think we should start. Any delay.
Ma'am, please start the discussion.
Shall I start the first question?
Yes, please. Yes.
We are going into unveiling the oral and dental myths and facts in menopause. The first question is, at what stage of perimenopause or menstrual irregularity should a woman be advised to undergo a comprehensive dental evaluation?
You will answer, yeah. All the questions will be answered by the specialist. I think, can we have one more mic, please. One more mic.
Acha, thank you everybody for this session. Thanks, Kirti. Now, answering this question, as we already discussed, once in 6 months, whether a patient is in a perimenopausal stage, a menopausal stage, postmenopausal stage, must go for a dental checkup. But like the trend in India is only when there is pain, the patient visits the dentist. So, when we see women above 50 coming to us, it's the other way around. When we see ulceration, bone loss, cervical caries, xerostomia, we refer them to the gynecologist. So I feel that it should be the other way around also. When these perimenopausal and menopausal women come to the gynecologist, they should be recommended that once in 6 months you should go for a dental evaluation.
If you allow me, I'll add one more thing.
Yes.
The kids should be also allowed to get them examined. With the parents, they should go to the dentist even in 6 months. It's very necessary because they never used to clean their teeth. Mama, ho gaya na. This is the answer, whatever they used to give. So it has to be given attention by the parents to clean the teeth, their own and the kids also.
I think it's vice versa, that the moment patient reaches to the dentist and they find that there is some changes in the mucosa and all, they can say that it may be perimenopausal and menopausal. They should be referred, and when we are seeing, we should refer them.
Thank you.
Why do we see increased candidal infections post-menopause?
See, during menopause, what happens, there is decrease in the estrogen level, and very little is spoken about progesterone, but even progesterone decreases. That all of y'all know better than us coming to our angle. So what happens because of that? The production of collagen goes down. There is dryness of mouth. The minute there is dryness of mouth, the microbial flora gets altered. And when the microbial flora gets altered, there is the lactobacillus and streptococcus level and increases. There is acidity in the mouth. So there is definitely a candidal infection or any kind of, even the caries rate increases. Because of acid reflux, erosion also takes place. So basically it is dryness of the mouth that causes increased candidal cases. And even above 50, above 60 postmenopausal women who suffer from diabetes mellitus, or they have some renal disorders, or many of them who are taking BP medication. Even in those cases, the chances of candidal, because there is gingival inflammation, there is dryness of mouth, again it's a chain reaction. As it has already been covered, bone loss is also there, so it is kind of multifactorial. Yes, gingival recession. And there is deficiency, there is B complex deficiency, B6, B12, folic acid, so ulceration also takes place. So that is the main reason.
But no hormonal treatment.
Hormone replacement therapy would definitely help, but when we advise the patients to, when we refer them to the gynecologist for hormone replacement therapy, their major concern is there a risk of breast cancer or malignancy? They ask us. Then we refer them to the gynecologist, but somehow they are not convinced. So I feel that awareness should be there among the women.
Awareness should be over there. They should be advised for the hormonal therapy with plus.
We refer them.
Examination and dental care should also be advised.
Yes, it goes hand in glove. Yeah, you wanted to add something?
Ma'am, as we are all aware that Candida is one opportunistic organism. It is just waiting for itself to develop. So these in the age group above 60 or with underlying comorbidities, the oral cavity is definitely having its own environment to help the growth of the Candida. So one is immunity that plays a very key role in the growth of the candidal infections, apart from the other confounding factors.
I think besides the immunity boosting, it's what you said, 5 to 6 sips of water every 2 hours is really recommended. Yes.
So both contribute to the candidate.
Yes.
Yes. Support is required for all. Yeah. You will, I think, first treat the fungal candidal part, and then so that it doesn't occur again, you will refer to the gynecologist so that her hormonal deficiencies are. Yeah, that's what.
Then there are a lot of underlying systemic factors.
Yeah, for those you can always refer. Yeah, that's what.
Talking about more post-menopause.
Yeah.
There are some mucocutaneous disorders also, ma'am, that appear primarily in the oral cavity before they appear even on the skin. So in those conditions, we treat those patients with systemic steroids. So there is also, in those conditions also, there is a development of the environment that will favor the candidal. So along with the steroids, we do prescribe we do give antifungal therapy to these patients too.
And how do you think that negligence on the part of the patient reflects in oral cavity?
Negligence on the part, see, oral hygiene is the most important thing. As far as oral care is concerned, genetics is a myth to a great extent. Because we have seen in our clinical practice over the years and since the older generation also, the grandmothers, the great-grandmothers would be wearing dentures. But if you see the next generation, because of proper oral hygiene maintenance, they have a full forum, you know.
And because of your facial implants and all that.
Yeah, no, the awareness is very important. Oral hygiene is very important. So, as she's already covered, brushing twice a day, flossing, using interdental brushes, then the jet, the water jet, all these are very effective. And the most important thing is prophylaxis. That is getting a scaling done every 6 months. And evaluation. If there is a bone loss, we do a CBCT. That is, cone beam computerized tomography. It's basically a denta scan of the maxilla and the mandible, through which we can...
You routinely do
it is a very simple, it's an OPG is an orthopentamogram, which is a 2D. When we take a CBCT, it is a 3D. So we can easily figure out the horizontal or vertical bone loss. And even the quantitative and qualitative analysis of the bone can be done. So we can refer the patient to a gynecologist or a physician for a further denta scan to evaluate other changes in the body.
Does genetic genes play a role? Like in so many diseases, genetic plays a role. For that bone resorption and the
Yes,
bone loss,
definitely genetics play a role. But if the measures are taken,
oral health hygiene is
oral hygiene is very important. And even like I've seen simple things like when you give iron and folic acid substitutes to the patient, there is a lot of difference. The ulceration disappears. The minute you give B12, B6, the ulceration goes.
We say with the age, wear and tear does occur. So, how can you support this theory? No, it will not occur if you take oral hygiene proper, keep oral hygiene proper.
See,
everything in your body, everything, your knee, everything is good.
Yes, sorry for interruption. She already said awareness.
No, this is all right. But for your knee, for your everything, the wear and tear is occurring.
Yes,
for the teeth also it is occurring.
Yeah.
But but nothing is
Nothing
permanent.
is like you will have to suffer because your mom suffered.
Yes.
You can always delay the process even if you are genetically predisposed.
It
you are
is,
taking proper help. Then
but
instead of
but
getting
gene is
sick,
there.
will be
You are
more
taking
taking
care of yourself. You are eating good. Your diet is good. You're exercising properly for your knees and all that.
Exercise is very important.
It's the same thing with the teeth also. So nothing is for 100% proof that.
See, earlier on there was no root canal therapy.
Yeah.
There were no implants.
Yeah.
Then the materials which we have for restorative materials like glass ionomous composite, tooth colored for erosion, for cervical lesions, they are all available. So, if every 6 months in the peri and post-menopausal stage, if the patient is treated, then it will be maintained for a long time. I'm not saying there will not be problems.
There is a myth that if you brush your teeth and the filling, it also comes out after some time. With capping also comes out. Capping also comes out.
What happens is,
implant has come out. My husband got the implant done and it came out after say about a year. After a year
see,
it came out.
even if you buy a Rolls Royce, you have to maintain it. So patients think कि implant लगवा लिया, अब कुछ
You
नहीं
can't
करना.
eat hard things with
No,
it.
it's not about hard things. You have to, the way you brush your teeth, you have to use an interdental brush. Every 6 months, you have to go for scaling, even when there is an implant. Sometimes
He
they are
said
screw
he
retained.
ate some hard thing he ate, came out with that.
Sometimes what happens, there is bone loss. So the supporting bone becomes weak. See, whether prosthesis, any prosthesis is either tooth retained or it is retained by the bone or by the gingiva. So if it's not maintained by the patient, even after delivering the prosthesis, even if it is a fixed or a removable prosthesis, if the gingiva gets weak, the mucosa becomes thin.
Yeah,
if
it
there is
cannot
bone
hold it
loss,
properly.
then the prosthesis will fail and then the patient will come कि filling nikal gaya, the crown nikal gaya. Sometimes the tooth is brittle inside, the tooth fractures, the crown is intact. So there are multiple aspects.
For everything.
Yes.
Ma'am, one thing I would like to add here is we have seen a great transition from the past to the present in every aspect. So oral hygiene, what was in the past is much with variation in today's generation. And to answer your question regarding the hereditary factors, of course they contribute a lot. But today's patients need not live a compromised way just because there is hereditary. There are treatment modalities which help them even in the conditions which follow the hereditary pattern. What you're saying is absolutely right. In patients who have early periodontitis or aggressive periodontitis, which we call, hereditary plays a lot of role. Early loosening of teeth, loss of teeth, he's got a role. But then with today's advancement techniques, we can take care of those conditions. We have facilities.
Now I'll go for some change. The experts are over there, but the question goes to the persons who are sitting over there in the hall. Should oral health screening be incorporated into the National Menopausal Health Program as a preventive public health strategy or not?
Yes, yes.
Yes.
It should be.
You know,
It should
now the time comes for the expert, they will answer.
Ma'am, to be very honest, way back in 2006, my main dissertation was a correlation of periodontitis with pregnancy and the birth outcomes, preterm delivery and the other
Even,
outcomes. Those days, I know as a student, if anybody comes to a senior practitioners, they may not be encouraged. But today I practice at Indore and I see many gynecologists referring the pregnancy patients for oral hygiene and maintenance. And I think this kind of collaboration is very much important, because end of the day, we are all in a profession to help the patient or anybody to improve their quality of life. We have so many ways. Then why not collaborate and reciprocate the data?
We get a lot of referrals from ENT and ophthalmologists. So I think now even the gynecologists should
join the hand.
Yes, for the oral health of women.
Now
Basically,
another question is over there. How significant is anxiety and depression in amplifying oral discomfort during menopause?
It is very, very important, because what happens whenever there is depression and anxiety, it affects the sympathetic nervous system, which everybody knows. So what happens in that case is the collagen reduces, the oral mucosa becomes thin. So again, the chain reaction, recession of the gingiva, bone loss, all these aspects start. And one thing I have seen in my clinical practice is, what happens is in the perimenopausal and menopausal stage, I had a patient who used to come from Delhi. She was married and settled in Delhi, but I have seen her since, quite some time. So she became anorexic because of the fear of sudden weight gain, central obesity. During the menopausal time, she stopped eating, like a crash dieting. So there was sudden hair loss, iron deficiency, folic acid, vitamin D, B12. So there was total bone resorption. So we are talking about depression and anxiety. So because of depression and anxiety of gaining weight, she did crash dieting, and that led to a lot of bone loss and a lot of dietary deficiencies. So it is an entire, so I think counseling is also very important.
It's utmost important in every field.
If
and
the
with
patient,
every patient.
If the patient is motivated and aware, then I feel there will not be mood swings, there will not be depression if you lead an active lifestyle. If exercise is incorporated, then one can counteract all these aspects.
I have one question. We have so many probiotics for all the diseases, for the gut also, for other. Do you have the same probiotics for oral health? Yeah, they are different probiotics.
Yes. See, earlier they were not there, but now Stim company has launched one toothpaste with the name of probiotic. They have added Bacillus coagulans to it. Now what this does, this maintains the oral flora. So the pH and the oral flora is maintained, and this organism, what it does is, this reduces the production of streptococcus, which causes caries, and lactobacillus. No, the organism which causes caries, mainly streptococcus is a common organism in dental caries. So this Bacillus coagulus, which is incorporated in the toothpaste, is basically a probiotic. And this helps in maintaining the oral flora. Why oral flora? If oral flora is maintained, salivation will be adequate, there will be no dryness of mouth, there will be no microorganisms decay. So like 80% of the battle is won. So, and you also have probiotic mouthwashes. Profera is one very common and a good brand. Like I have prescribed it to my patients and seen it. toothpaste also. Toothpaste is by why I'm quoting these two, nothing to do with the companies, but these I have prescribed to my patients and I have seen the effect. It's really, you know, it maintains the oral flora.
Yes, Dr. Vanaifer, I feel it's very much like the vagina, where we give a lot of probiotics.
On a regular basis.
So,
And another thing I would like to add. Sorry?
On a regular basis, do you recommend a regular mouthwash?
Only after you visit a dentist.
Okay.
Because agar gingival inflammation hai, periodontitis hai, तो chlorhexidine is the mouthwash of choice. Then if the patient is in a menopausal or a post-menopausal phase, then you have to use an alcohol-free mouthwash. Because if you use a mouthwash with alcohol, there'll be increased dryness. Then these probiotic mouthwashes would be very good in a perimenopausal and menopausal.
Probiotic mouthwash? Which name you suggest?
Profera.
I think we can have that discussion
Yeah,
later
we can have.
because we are running short of time. And Kirti and I was really skeptical about this forum. Ki how we are going to organize this oro-dental health in menopause. But I feel it's really a very interesting and innovative topic. And yeah. Yes.
Yeah, two things I'd like
Yes,
to
yes,
add. Yeah.
Definitely. Please go ahead.
No, no.
What the role of AI in your practice? How is it going to help you? Is it going to replace you?
No, because AI doesn't allow you to think. Every patient is different, I feel. Here, I think I'm being a little contradictory compared to the youngsters because ChatGPT and AI doesn't allow you to think. And what I feel is, apart from the standard problems that come, every patient is different. So it can be used. It can be used as a supportive tool, but it cannot replace. That is what I feel. And there is another toothpaste by the name of Dente 91. This they have added nanoparticles which strengthens the enamel. They have added. So this.
Any age you can use it.
This I'm talking about post-menopausal and menopausal because there is erosion of the enamel. So nanoparticles are added. So that is help.
So
And
do
they've
you
also
think there
added
is
lactoferrin, which is again antifungal, antibacterial and anti-inflammatory. So these 2-3 things, if you ask which mouthwash, which toothpaste, probiotics, and these 3 are probiotics.
Write these, all these in that group. We have got a dental group now.
Okay.
You can write those names.
And one more very simple modality is our simple paneer which we eat. If you chew it for about 3 minutes ideally, then it improves the microbial flora. There is a sustained effect up to 60 minutes.
For the audience,
And it
there is
helps, we have seen cases, it helps
setup
in
for the
remineralization
dental
of the
care.
enamel, जो menopause में होता है.
This is something really new. we
So
have-
this is
started
very
cleaning.
inexpensive and
but we don't chew it.
which one? I am not a very good fan. Actually, any toothpaste.
Two important points you were saying. कुछ अभी बोलने वाले थे last में.
I think any toothpaste with SLR, like soap, shampoos, all have sodium lauryl sulfate.
Okay.
हाँ,
They
तो
should not be used.
They should be avoided. They should be avoided. So that is an important factor. And this paneer is a very simple and sounds like a layman, but it's very effective. And earlier we used to give them to young children, but even in adults and menopausal, the remineralization of the tooth structure is visible.
Okay.
But provided
Thank
it is
you.
chewed for 1 minute.
Not 3 minutes.
Chewing paneer. Not only eating, chewing for 3 minutes, yeah.
Like,
We never chew it, no? We directly
It's
eat
like chewing the water. It's like chewing the water.
see, fluoridated chewing gums are there, but they should be sugar-free. Basically, it is stimulation of saliva. You can even massage your gums for stimulation of saliva. So,
it. Is there a proven
I
link
thank-
like
Ma'am,
Do you think there is a proved link between osteoporosis and periodontal disease? Like patients suffering from osteoporosis will have these tooth
See,
problems?
Yes, bone loss takes place everywhere in the body. So similarly, bone loss in the maxilla and the mandible. And there is a evidence-based study. There is an article in which it shows that in L1, L2, yeah, T1, T2, it corresponds to, say, posterior tuberosity of the maxilla, different particular regions. So there is a definite link.
Ma'am, we'll have this
you
question
re-
answer
do you
session
recommend
later.
that-
I think, thank you very much every participant for this wonderful session. And we have 2-3 stalls for the tartar cleaning, sensitivity test, and some tool kill. So please visit that. And it's really, really a wonderful session. And having both Dr. Padmaja and Dr. Banaifar for this super specialist dental opinion, and all our gynec, Dr. Reddy, Prashanti, okay, sorry, Dr. Prashanti. And it's really a message for all of us that there should be a good collaboration among us for a better health of a woman. Thank you very much.